Hello and welcome. My name is Chris Rowena, and I'm the lead communications analyst for HCAI Workforce Development. We're thrilled to have you join us today for the Song Brown Registered Nurse and Licensed Midwifery Technical Assistance webinar. Quickly, let's talk about who this webinar is for. New and continuing applicants to the Song Brown Registered Nurse and Licensed Midwifery programs. The RN and LM programs provide grant opportunities that will result in funding organizations to educate and train students to work in underserved communities. And Song Brown program is administered at the state level by HCAI. Talk about the agenda real quick. We've got the housekeeping and introduction that will be followed by program updates, application processes, and requirements for the RN and LM programs. And we will have a question and answer session at the end. And let's talk housekeeping. This webinar is hosted in Microsoft Teams. If you're not familiar with the platform, you can find the chat and the view controls in the menu bar at the top of your screens. The chat option will be open for asking questions during the Q&A session, which is at the end of this webinar. And this webinar is being recorded and will be available within 7 to 10 business days on our website. And with that, it is my pleasure to introduce Cassidy Naval, the Song Brown Program Officer, who will get us started.
Good afternoon, everybody. Thank you, Chris, for the introduction. And thank you for joining us today for the RN and LM webinar. As Chris said, I'm Cassidy Naval, the Program Officer for the RN and LM Song Brown Grant Programs. Let me move forward. Okay, here are some key dates for the application cycle this year. Registration is open year-round, so if you have not registered yet, please register now on the HCAI funding portal. Application released last week, September 10th at 3 p.m. Early submission deadline is October 9th at 3 p.m. And the final submission deadline is October 23rd at 3 p.m. All right. Before you apply, please make sure that you have approval from your coordinating authority to apply for a grant, and that your coordinating authority has read and approved all of the terms and conditions contained in the grant agreement. Applicants must agree to the terms and conditions before applying or before receiving funds, as HCAI will not make any changes or amendments to terms and conditions specified in the grant. Funds shall not supplant any existing federal, state, or local funds. Here are some major changes for the RN existing and expansion application this cycle. We reduced the existing slots from 30 to 10 at $30,000 per student for the life of the agreement. Expansion was reduced from 10 to 5 maximum slots at $60,000 per student for the life of the agreement. Just to note, the capitation rate for existing and expansion slots did not change from previous years. We are just now simply reflecting them for the entire life of the 2-year agreement and not yearly. There will also not be an import function this application cycle, so you cannot import previous information from past applications. And the final change to RN existing and expansion is we are no longer going to score underrepresented medicine students and graduate data. You must still provide that information for data collection purposes only. All right, some information to gather for your application cycle. You must have authorized grant agreement signatories and paid data record signatories available for your application. We just need their information for the purposes of the application. We also highly recommend having your W-9 IRS forms ready for when you're filling out your application, because we do need your organization name and or doing business as name, as well as your address for your program. We need training site names and addresses for all training sites used in the academic year 24 and 25. We need student information for those students graduating in academic year 24-25 and academic year 25-26, including their race and ethnicity data. We also need graduate information for academic years 22-23 and 23-24, including their graduate practice sites within the state of California, race, ethnicity, and for the entry-level master's programs, we also need your national provider identification numbers for your graduates. I will discuss the required documents in the following slides, so we'll skip over that for now. For the RN new and LM new, we need the same authorized grant agreement signatories and payee data record signatories, as well as recommending that you have your W-9 IRS forms at the ready for when you're completing your applications. For new programs, we are asking for anticipated training sites, names, and addresses. This is the training sites that you believe you will utilize with your program. We also need program expenditures related to the accreditation or approval of your program. The required documents for RN existing is going to be your most recent program approval letter from the BRN. For expansion, you need the most recent expansion approval letter from the BRN stating the approved number of additional slots that you can have for your program. For RN and LM new, we need 2 documents, a timeline for approval or accreditation, and the sustainability letter. The timeline is just a planned schedule for securing your accreditation or approval from your approval accreditation bodies. And then the sustainability letter is a letter from your institution that endorses your program and speaks to the sustainability of your program beyond Song Brown grant funds. Here are some helpful resources that you can click on. They're pinned to the top of the chat. The HCAI funding portal is where all applications will be submitted. The RN grant guide and technical assistance guides are also posted on our website. The LM grant guide and technical assistance guide is also posted on the Song Brown website, as well as the Song Brown glossary for any terms that you want clarification on throughout the application. We're now going to walk through the electronic application registration or funding portal. I will interchangeably name it the same thing, eApp or funding portal. So just know they are one and the same. For best experience, we recommend using Google Chrome or Microsoft Edge. For any new or returning applicants, this is the landing page for the HCAI funding portal. You will see the sign in or register button there. That is where you will click regardless of if you are a new or returning applicant. This is the sign-on screen for the funding portal. If you are a returning applicant and you've applied in recent months, you can just simply sign in. If you are a returning applicant that has not signed on since April of 2024, you will need to sign up, or you will need to register like a new applicant, because we did transition to a 2-step authentication system last April. So make sure you do register just like a new applicant would. And then all new applicants will have to register in the Sign Up Now button with the arrow pointing at it. You will need to enter your personal information, email that you're going to use, and then you will receive a verification code to complete registration. To set up your profile for new applicants, you will have to select the organization user type. Do not select healthcare professional, as Song Brown is an organizational grant, and you have to be an organization user type to get access to those applications. To assign an organization to your profile, please make sure to check the magnifying glass first to search for any pre-existing organizations that are registered into our system. Most organizations are already in the system, so please use that search button before you request for a new organization, because sometimes it does take us 5 business days to approve any new organizations. If you cannot find that organization in the search function, you will then click the Request Organization button pointed down below. If you do need to enter a new organization, you will enter your organization name and address into the new organization form, and you will confirm, you will click submit, and Song Brown staff does review all new organization requests within 5 business days. To complete your profile, you will enter your first, last name, title, email, phone number, and then press submit to finish your profile. All newly created accounts are assigned as grant preparers. Grant preparers do not have the ability to initiate or submit applications. To do so, you need to be a program director. Once you create and complete your profile in the funding portal, you need to email us at songbrown@hcai.ca.gov to request to be upgraded to the program director role. Only accounts with the program director role can initiate or submit an application, and only program directors can move forward with, can open up any application. Program directors can also assign other users to their profile to help them complete their applications. In order to do so, any grant preparers will need to create their own profile in the funding portal, and the program director can go in and assign others using the tab on the left with the arrow pointed, and they can add their users that way. Make sure that the grant preparers have their profiles completed before you add them. To find the applications, you're going to go to the Apply Here tab in the blue ribbon in the HCAI funding portal. You will see the applications present there: Song Brown Registered Nurse 2025 or Song Brown Licensed Midwifery 2025. That will guide you into the application. Here are some helpful tips to help you navigate the application. So on the bottom left of all application pages, you will see the previous and/or save and next buttons. The previous button will guide you backwards in the application as you needed, and the save and next button will make sure that any information entered in a completed page is saved and move you forward throughout the application. If you do leave the application and complete it at a later time, you will navigate to the Grant Applications tab in the blue ribbon and search for the application you are trying to retrieve to find those saved applications. Throughout the application, you will also see red asterisks next to text fields. This indicates that that field is required and you must complete it before moving forward with the application. You will also see a blue circle with a white question mark throughout the application. This is indicating a tooltip that will give you more information on what we are looking for that particular field. Now we're going to do a page-by-page walkthrough of the existing and expansion RN applications. This is exactly what you're going to see when you open up the application. So this is a great resource for you to have to know what we're looking for throughout the app. The first page you're going to see is the program information page. The top section of this page is going to be pulled directly from the program director's profile page. So if any of the information in that top section is incorrect, the program director will have to go into their profile, will have to exit the application, go into their profile, make those updates, and then go back into the application. From there, you're going to select which RN program pathway you are applying for. There's ADN, BSN, and ELM. Any program that has multiple program pathways can apply for all program pathways. They just have to be separate applications. So if you are BSN and you also have an ELM at your institution, you can apply for both, but they have to have individual applications. From there, if you please search for your training program title with the magnifying glass, just like the organization. Search there first to see if your training program is already registered in our system. If not, you will click Training Program Not Listed, and then you will enter the training program title and address accordingly. For any existing and expansion applicants, you will select which pathway you're applying for, existing and/or expansion. You can apply for both. You just need to check off both. For both, you will have to check off all the boxes to make sure that you are eligible to move forward with the application. The contract administration page is where I recommend you have that W-9 IRS form to make sure all of that information is correct. We also recommend you partnering with the contracting team at your institution to make sure that they have the most recent information for you. You will enter your contract organization name, the doing business as name, as it is on the W-9. Do not enter a doing business as name if your W-9 does not have a doing business as name. From there, you'll enter your entity type, either governmental entity or non-governmental entity. The contract administrator is the main point of contact for your agreement. So this is the person who we will reach out to most often. They do not need to have signature authority because they are not the ones signing the grant agreement. The grant agreement signatory will be listed below, and they are the ones who must have an authorization to enter into any grant or contract. If your payee data signatory is the same as your grant agreement signatory, you will select yes in this question, and you do not have to fill this section out. If they are different, make sure that your payee data record signatory is also an authorized individual who can give us their payee data record. This is also where you will enter your legal address for your institution or your program that is listed on your W-9. If you have a different payment location where payments must be made. You also have an opportunity to write that here. The program description page is your opportunity to provide us information about your program, the successes you've had, if your previous applicants, how Songbrown has helped your program enhance the education and training of students, and what you plan to use the funding for in this next cycle. You do have a maximum character limit of 2,500 characters. That is characters, not words. So please make sure you are aware of that. You will receive an error message once you get to that 2,500 character cap. If you are copying and pasting text from another document, please verify that all of the information you want to include is included and was not cut off because of the 2,500 character limit. The program data page, you will select what information you're going to provide for us. If you have any 22, 23, and or 23, 24 graduates, you will select the student and graduate data option. If you have no graduates for the 22, 23, 23, 24 academic years, you will select student data only. And based on what you select above, you will inform us what year your first set of students was admitted. This is the training site page for our existing expansion. The first question up top is informing us the percentage of total clinical hours that all cohorts spent in RNSAs. From there, you're going to add your site, clicking the Add Site button. And you can also review and edit any training sites by using the drop-down with the arrow pointing there. This is the pop-up you will see when you create a training site or add a site. You will enter the training program name and address and the NPI number for that training site. We have provided the link to the NPI registry right next to that NPI field for your convenience. The program expenditures page is where you're going to request the number of slots that you would like. So maximum slots for existing is 10, maximum slots for expansion is 5, and you request that there. At the bottom half of the program expenditures and funding page, you will report the total amount of expenditures made by your program in the year 24-25. This is all expenditures, not just for Songbrown, that if you were a previous applicant, not just what you spent Songbrown money on. This is all expenditures. The total for your expenditures must be greater than or equal to the total funds requested. For aggregate student data, we are looking for the enrollment capacity for your 25-26 academic year, the total number of students that applied, the total number of students enrolled, and then the breakdown of your enrolled first years and enrolled second years. If you have multiple start dates for your years, for your academic years, for first year students, that will be anybody that started fall of 24 to summer of 25. And for enrolled second years, that will be anybody that started fall of 23 to summer of 24. This is where you will enter all of the aggregate data for race ethnicity for all of your students. If you have students who identify with multiple race or ethnicities, you can enter them in the other not listed category. And the total of the students here must match the total of the students above in the previous section. In graduate data, you will give us a breakdown of the number of graduates in academic year 22 and 23 and academic year 23 and 24. You will then add a graduate using the Add a Graduate button. And then just like with training sites, you will click review, edit, or delete if you need to edit your graduates. This is the create form for adding graduates. Here we'll ask for the graduating class, first and last name, gender, ethnicity, and race, as well as their NPI number for the entry-level master's graduates. This will be the NPI number for the graduate themselves and not their practice site. You also enter their practice specialty and if you know their graduate practice site. If you do know their graduate practice site within the state of California, you will enter their practice site name and address. If your graduate works out of state or you do not know the graduate practice site, you enter no there and give us either out of state or other. The required documents page is where you will upload those approval letters from the BRN for either existing and or expansion. To upload any documents for existing, your document must have the prefix APPR underscore to be accepted and uploaded successfully. If you are uploading an expansion letter, that letter must say EXP APPR underscore as a prefix to be accepted and uploaded. Once you have successfully uploaded a document, that button will turn green. If the button is still red, that means it is required and you must submit before, you must upload the document before moving forward. Once you upload all of those documents, you will then certify your application. Only program directors may certify and submit the applications. Just a reminder, if you do submit your application, you will no longer have the ability to make any further edits unless you're utilizing the early submission review that we are offering. Any early submission reviews we will give you feedback within 5 to 7 business days after the submission, and we will give you an opportunity to make edits and reopen your application. Next slide, please. We are now going to go through the RN and LM new application walkthrough. So the RN and LM new applications are pretty identical. There are a few things that are different that is geared towards one specific application, and I will point those out as we go along. So for RN new, the program information page will be the same as RN existing and expansion. You will just have to select, are you a former Song Brown applicant? And you'll have to select no. From there, you'll be prompted to enter a training program title as well as an address and select new programs. You will have to select those 2 checkboxes at the bottom to move forward and be eligible to apply for new programs. Okay. For LM new, the program information page is a little bit different. You're going to be asked if you are Midwifery Education Accreditation Council accredited already. If you select yes, you will then be asked if you are seeking Medical Board of California approval. You must say yes to that question in order to continue with the application. If you say no, you cannot continue the application and you're not eligible to apply. If you are not MEAC accredited already, you will select no, and you will be prompted to answer the question if you are seeking MEAC accreditation. If you select no for seeking MEAC accreditation, you will also not be eligible to apply for LM new. From there, just like RN new, you'll enter your training program title and the address for your training program. The contract administration page will remain the same for all applications. So we move on to the program description page. This is your opportunity to provide us with the summary of your new training program and how you plan to include, how you plan to meet Song Brown statute priorities with your new program. You will also have a 2,500 character limit, 2,500 characters to provide us with an answer here. If you exceed that limit, you will receive an error message. If you copy and paste text from another document, the text will cut off at 2,500 characters, so please double check your information to make sure that everything was captured. You will see 5 strategy questions. You will see 5 strategies with 5 strategy questions. You'll see 5 strategy questions for all RN and LM new applications. All the questions for both are identical with the exception of wording. So for RN new, you will see nursing students, and for LM new, you will see licensed midwifery students. Otherwise, the strategy questions are the same. So you can select multiple responses per strategy, and you will also be given the opportunity to provide us with a narrative of how you plan to incorporate and implement those strategies into your new program. Again, you will have 2,500 character limit for each of those narratives. This is strategies 2 and 5, 2 of 5 and 3 of 5, and strategies 4 and 5. All of these are present in the technical assistance guide. I know I breezed right past them, But if you check out the technical assistance guide for RN or LM, they will be there as well, and you can read them prior to applying. The RN new anticipated training sites page is just going to ask you if you have any anticipated training sites for your new program. If you say yes, you'll be prompted to add those sites. If you say no, you will just move forward into the next slide. The LM anticipated training sites page will ask you what is the anticipated percentage of total clinical hours that will be spent in areas of unmet need for licensed midwiferys. And then it will ask you if you have any training sites that you wish to report. If no, again, you will not be prompted to enter any sites. If you say yes, you'll be prompted to enter those sites. And the create form is going to look the same as it did for RN existing and expansion. So you will enter that training site name and the address and the NPI for the training site. For program expenditures, you're going to inform us how much you are requesting for the application. RN News maximum is $1 million and LM News maximum is $500,000. From there, you will upload those timelines and sustainability letters. For the timelines, you will upload them with the prefix LTR time underscore to be accepted and uploaded. For sustainability letters, you will upload them with LTR SUS underscore for it to be uploaded and accepted. Once the document is successfully uploaded, that box will turn green. And if you still have a document that needs to be uploaded, that box will be red. And finally, again, the program directors will have to click certify and submit the applications. Please utilize that early submission deadline for us to review your applications prior to submitting, and we will review those applications and provide you feedback within 5 to 10 business days.
All right. Thank you so much, Cassidy. As our team implements the latest cycle of this program, these webinars are an important way for us to keep you informed and respond to your questions. As we transition to the Q&A session, ask a question simply by clicking the chat button in the menu bar and type your question. We're going to do our best to answer as many questions as possible during our time together. If you do have a question about a highly unique circumstances, we may ask you to email our team at songbrown@hci.ca.gov so we can provide the most accurate information possible for you today. And the chat has been turned on, so we can go ahead and start receiving questions. I'll note while we wait for some questions to show up that we have posted in the chat the resources today that we've been discussing. You can find the link to the funding portal, to the grant guides and the technical assistance guides. And we also have the dates there as a reminder for you. Still not seeing any questions yet. Go ahead and give us a thumbs up if you're able to access the chat in the React button. Make sure that we know that everything is working. See a thumbs up there. Thank you. All right. Well, it looks like the chat is working. So let's see. Close it and reopen it. Maybe we'll see if there's some questions here today. All right. One thing I'll remind you as well, we are recording this webinar. We also recorded this morning's webinar, and we will have those on our website within 7 to 10 business days. I see the chat. There was something placed in it. You see the resources guide that was placed in the chat. Is that what you're talking about, Shirley? You don't see the resource chat entry. Okay. Let's go ahead and we can repost that again. Let's see if that makes it visible. Thank you, Shirley, for letting us know about that. Shirley, are you able to see those resources now? Perfect. Okay. Well, it does look like things are working. We just waiting for some questions. Yes, thank you, Shirley. Appreciate that. Anything today that we need clarification on? Thank you. I appreciate you letting us know you don't have any questions. I think I remember seeing you earlier in this morning session as well. All right, Shirley asks, when would the new cycle begin?
Just to clarify your question, are you speaking when the application opens or when the grant agreements would start? The agreement. Okay. So the agreement would start 6/30/2026. So that is the start of the agreement. That's what it will be listed on your grant agreements if you were to be awarded.
That question, Shirley. Let's see. Kimberly asks, is the grant funding only provided for growing slots in the RN program?
No, we do have two pathways for RN existing and expansion programs. So existing is for programs that are BRN approved and they have students and or graduates to present. And then expansion is just an extra funding. So you can apply for both. So if you are approved to add more slots to your currently approved number of slots, you can apply for that as well. So to answer your question, no, it is not only for growing slots.
Thank you for that question, Kimberly. Jessica asks, if you start the application, will it save your progress or do you have to complete it in one sitting?
Yes, so it will save your progress as you go along, as long as you are completing the page and then pressing save and next. You can always exit out of your application and go back into it using the grant applications tab in the funding portal.
Right. Shirley asks, is it only the director who can apply for the grant?
No. So the director must initiate the grant, the application, but you can, but the grant preparers that are assigned to the program director's profile can complete the grant or the application for you, but the program director must be the one to certify and submit. So essentially, the program director just needs to initiate the application and submit the application. The grant preparers can kind of do all the stuff in the middle if you want them to.
All right, thank you. Kimberly says, my dean has tried to provide me with access to the grant and we have asked for that to happen, but there hasn't been any response. Can you please advise?
Yes. So I made sure that you were a grant preparer for your dean this morning. I will check again later and shoot you an email in private for that to make sure that you have access. If your program director already initiated the application, you will just need to go into the grant applications page tab to make sure it's there. But I will verify and send you an email before the end of the day.
All right, thank you for that, Cassidy. And Kimberly says thank you. Let's see. Next question. We were approved for 30 for this application. Do I put 10?
What was the question? I see. We're approved for this for 30. Yes. So you can request for the maximum number of slots, which is 10 this cycle.
All right, thank you. Let's see. So we had a clarification, meaning start the process of the application. Shirley was asking for clarification on the director's the one that starts the process for the application, right?
Yeah. So the program director the person who's assigned the program director role, which I believe Shirley you are the program director for your program, you must initiate the application. So you must open the app, create the app, and then at least get to the contract administration page. And from there, the application will be saved and your grant preparers can go in and complete the application for you from there.
It looks like Shirley's asking for a little more help to make sure that everything's set up. So sounds like you'll work with Shirley offline to make sure that everything's working good.
Yep. Yeah, Shirley, go ahead and shoot us an email at songbrown@hci.ca.gov, and I will help you out with any changes that happened in your program since last cycle.
Thank you. All right. Kelly asks, if we have been a recipient of SBG in the past, should our login continue to work, or will we need to initiate a new account?
Yeah, your account should work as long as you have applied since last April. April 2024 was when we transitioned over to the new system. So if you applied anytime after that, your login should continue to work. Kelly, I believe you do have a current grant agreement with us, so your account should be fine still.
All right, very good. All right, these are great questions so far.
And while we are waiting for more questions to roll in, I do want to just highlight that all of these resources that are pinned in the chat are also available on our website. The technical assistance guide will be a great resource for you to walk through the application before you enter the application. And the grant guides will have samples of the grant agreements for you to show those authorities that you need approvals from. So please check out those resources that we have pinned in the chat and also on our website. They are very, very useful and can answer most of the questions that you might have throughout the application process. And any other questions, just email us at that email that Chris just linked in the chat.
Thank you, Cassidy. Those are good notes. We have plenty of time this afternoon to answer all your questions. So as you're thinking about it, go ahead and get those questions in. Thing I want to re-emphasize is the importance of the early submission review for October 9th at 3 p.m. Taking advantage of that is definitely a great way to make sure that you have the best application possible.
Piggybacking off of what Chris just said, I do want to say, because this was asked in the previous webinar, so I want to kind of say it here. The early submission deadline is for us, the Song Brown staff, to verify completeness of your application. We will be looking to make sure all the information we are looking for is present in your application. We do not score apps until the cycle has closed, so we cannot tell you if your application scored high or low, or provide you any feedback regarding that. So just flagging that to let you know that we are only checking for completion, but it is very useful because sometimes you might miss something here and there. And we want to make sure that your application is as strong as possible, as this is a very, very competitive cycle this year. And we want to make sure that everybody has that opportunity.
Any other questions this afternoon? One piece of information that would be interesting and helpful for us, understanding how many of you are returning Song Brown awardees and how many are new. If you would be willing to let us know in the chat, that would be great. Shirley, appreciate your response there. Jessica, thank you. Kelly at Cerritos College returning, fantastic. And Sarah, we got a new one. Welcome to the Song Brown process, Sarah. We've got Rana and Belinda returning. Vaughn, welcome to the Song Brown process. And Pacific Union College, Tamara, we appreciate you all joining us today. In particular, for those that are new, are there any questions that we can help you with today in orienting for your response? I see Loma Linda, thank you. And Imperial Valley, new, welcome.
Let me see.
And Urena, I see your organization is returning, but you are new. Welcome personally to the process.
I also want to make a clarification as well, because this was asked in the previous webinar. New program applications are for programs that have not received BRN approval and have not enrolled their first set of students. That goes for both RN new and LM new. So if you're an RN program that is just starting up, but you're a new applicant, you are still but you have at least one set of students, you are considered an existing program. And then for LM new, you must be brand new, no students, just like RN. So new program means no students yet and just receiving accreditation or approval.
It's an important note. Thank you, Castany. Well, any other questions that we have today? If not, you can give us a thumbs up. Let us know that you got all your questions answered. We do want to make sure that we take advantage of the time that we have today. Once again, if we do end today and later you think of a question, just go ahead and email us at songbrown@hci.ca.gov. San Diego City College returning. Thank you, Susan. I'll give about 30 more seconds here for any questions that you may have. Shirley, thank you for mentioning Compton College. Very good. Glad to have you. All right. Well, if there are no more questions, we'll go ahead and move on to the closing of our webinar today. Thank you all for your engagement and your thoughtful questions. Again, if we didn't get, or if you think of a question later, go ahead and email us at thatsongbrown@hci.ca.gov, and Castany or one of our team members will be happy to help you. We do appreciate you joining us to learn more about the Song Brown Registered Nurse and Licensed Midwifery Program. This program is an important part of HCAI's health workforce development efforts, and we're grateful for your engagement with us today. A few reminders before you go. Early submission review deadline is October 9th at 3 p.m., as I mentioned, and the application closes on October 23rd, also at 3 p.m., so don't wait to submit. And we would love for you to check out some of the other resources that we have. You can visit our website to explore the full range of HCAI programs and resources available to you. You can also follow us on our social accounts and tag us with the great work that you're doing. We would love to hear about it. And then another thing that you can do is subscribe to our monthly Health Workforce Programs Update newsletter. And this is a great way for you to stay informed. All you have to do is simply follow the link and select any topics of interest under the healthcare workforce heading, and you will be added to the list. You can contact us at our phone number here, 326-3700, or as we mentioned, songbrown@hci.ca.gov, and we'll be happy to assist you with anything that you need there. With that, that does conclude our webinar. Thank you for attending, and we hope you have a wonderful day.